All right. Hi. Good afternoon. Good morning. This is Dr. Eunice. I your only one. Your one and only. I am going to be speaking about the mental disorders that are found in DSM-5. TR is actually one R. I don't know why I have two R's. That's an error, so I'm going to correct it before I go on. The reason why I'm actually doing these videos is because I am at a place where I need to remember these um, symptoms when I find them in a test as I'm preparing to do my MFT exam. For anyone that is doing counseling degree or medical degree might need this, and I'm kind of like trying to teach them to myself as I also teach you if you want to grab this information quickly. So, I am talking about bipolar I disorder today. So, let's talk about bipolar I disorder. So, what is bipolar? When people say, I'm bipolar, he's bipolar, what are they talking about? So, we're talking about a mood disorder that is usually characterized by episodes of mania. They might involve increased energy, elevated mood, impulsive behavior, and these alternating episodes of depression might be persistent in sadness, loss of interest, loss of pleasure in activities that one likes or used to like. And also, I'm going to be talking about the bipolar I disorder, what that individual looks like, and what are some of the symptoms according to this specific criteria. So I'm using DSM-5, and as I said again, this is not a diagnosis. I'm not doing a diagnostic procedure here. It is for study only. So the symptoms that we usually talk about, the first ones is the manic episode. Um, so the manic episode would be if somebody had this manic episode. It's when they have experienced distinct period of abnormally and persistent elevated or irritable mood that lasts for at least 7 days or 1 week. So the duration might be any duration in the hospital if it's necessary, is accompanied by symptoms like increased energy, increased need for sleep. They have these racing thoughts. I meant decreased need for sleep, so they're not sleeping. So if you have a elevated mood, you're not probably going to be sleeping. You have racing thoughts and definitely excessive involvement in activities that require very high or painful, that may produce very high or potential for pain, as in, the result of it. So to meet the criteria of a manic episode, an individual must experience at least three of the symptoms that I'm going to read here. So, and if the mood is irritable, it needs to be four, you know. So we're going to talk about inflated self-esteem or grandiosity. That is the first symptom. So if your client or your loved one has more than three symptoms, so the first one is inflated self-esteem. Increased or decreased need for sleep. You're feeling rested after only 3 hours of sleep. Sometimes that feels like me, like when I'm preparing for an exam. But I'm talking about if they persist and if there are 3 to 4 symptoms according to DSM-5. So somebody remains more talkative than usual, or has the pressure to keep talking to everyone. It's not the one that my husband says that women talk a lot, 20 words a day. That's not what we're talking about. So if you talk like me, you don't have bipolar. Flights of ideas, racing thoughts. Most of the times you're causing distractibility. Attention is easily drawn to very unimportant stimuli, like the plane is passing, you see a cat and you're running out and you're leaving everything that you're doing. So that type of distractibility, so you're being easily distracted. And then the other one is increase in goal oriented or directed activity, or psychomotor agitation. And then obviously the last one of the 7 is excessive involvement in activities that have very, very high potential for painful consequences, like reckless spending, just shopping, going around, doing some type of business investments that are very foolish, that are not, you're not putting your thought into. And of course, even some type of sexual misbehavior. So let's go to hypomanic episode. The difference is the symptoms need to last for 4 days. Okay, hypomanic. So a hypomanic episode is definitely similar to manic episode, although it is quite less severe. So last for at least 4 consecutive days, and it's not going to be as severe as the manic episode. So hypomanic is also characterized with increased energy, elevated mood, goal-oriented activities, but as I said again, the symptoms are less severe and they last for 4 days. So obviously if the symptoms have, they are more severe and they go past 4 days, definitely we'll be looking at manic episode, if that makes sense. So to meet the criteria for hypomanic, an individual must experience at least 3 of the symptoms that we have in the manic episode, and they need to be less severe and last for only 4 days. Okay, so the other one, the other category is major depressive episode, which is at the bottom of my board. So major depressive episode is going to involve a period of at least 2 weeks. So we have progressed from 7 days to 14 days, which is 2 weeks, with persistent depressed mood, loss of interest or pleasure in nearly all activities, along with obviously additional symptoms such as appetite and sleep fatigue, appetite loss, sleep fatigue, and now feeling worthless, the feelings of worthlessness. So to meet the criteria of the major depressive episode, your patient or your loved one must experience at least 5 of the following symptoms during those 2 weeks period, and at least one of the symptoms must be either mood or loss of interest in pleasure. Okay, so be at least 5 of them, but one must be either depressed mood or loss of interest or pleasure for somebody to actually qualify for the major depressive episode. Okay, so first of all, the interest of depressed mood most of the day, nearly every day. Markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day. For example, if there were a teacher, they don't want to play with the kids, they don't want to mark, they don't want to grade, they don't want to wake up. So yeah, those are just examples. Significant weight loss when one is not dieting. So the weight gain or decrease or increase in appetite. So the number 4 would be insomnia or hypersomnia, nearly every day. So you're either sleeping or not sleeping. Psychomotor agitation or retardation is nearly every day. Fatigue or loss of energy, nearly every day. Feelings of worthlessness or excessive or inappropriate guilt because of something that you haven't done. And we went through these symptoms somewhere as diminished ability to think or concentrate or indecisiveness. You can't make any decision. Your mind is blocked and it's very, very hard to think or concentrate or any kind of activity. And when you can't make any decision, you are indecisive. So recurrent death, thoughts of death. So the recurrent suicidal ideation should be without a specific plan or a suicide attempt or a specific plan for committing suicide. So it's just feeling worthless that leads to, I feel like suicide would be better, but this person does not have any plan, has not attempted suicide, and doesn't have any specific, hasn't attempted and doesn't have a specific plan for committing suicide. So obviously after that, we do know that you have to also do the screening for suicide and just make sure that someone is safe before anything else. So how does this disease or how does this disorder or these categories affect or impact somebody's life? So we know that bipolar 1 can really impact daily functioning of a human being as well as relationships. So definitely at the end of the day, quality of life is lower. So individuals that are experiencing extreme shifts in mood and energy levels, that is very, very dysfunctional. So if you are if your client is fluctuating between manic and depressive episodes, they can disrupt work, school, social activities, sometimes even leading to financial difficulties, because what if somebody is not able to work because it's part of losing interest in the things that they loved to do. So strained relationships as well as challenges in maintaining stability. So for the treatment for this disorder, the bipolar 1, we do know that there is medication. So from my point of view as MFT candidate, I know that this is, you don't just go to medication. We are more of psychotherapy. So for medication part is the doctor might prescribe mood stabilizers such as lithium, anticonvulsants, or the typical antipsychotic medication, just to help stabilize mood and prevent the episodes of mania or somebody from becoming very sad, as in depressed. So when we provide psychotherapy, CBT, cognitive behavioral therapy, psychoeducation, and things like interpersonal and social rhythm therapy, which is also stands, IPSRT stands for interpersonal and social rhythm therapy. This can provide help the individuals to become actually to get better and also be able to understand. Psychoeducation is mainly about understanding their condition and also being able to develop coping skills or coping strategies to help them manage their stressors or even their triggers. So for every mental disorder, so understanding the number and duration of symptoms, the number of of days that somebody has had the symptoms, and how many symptoms under each criteria, it is very, very important. It is required for diagnosis. Again, I am not here to diagnose. This is not a diagnostic procedure, but for you to remember. So it's simple. If you want to take a peek, if you want to share, if you want to subscribe, if you want to like or comment, please let me know how I am doing in this. I know that there are some people that will use this information for their exam, and I hope that I have clarified everything. Thank you so much for listening, and well, good luck.